This is KTVO's Good Morning Heartland.
And welcome back. This morning we're learning more about preventative exams and why they're important for women. This morning we have Angie Shuey, a women's health nurse practitioner from Complete Family Medicine, to break it down for us. How are you doing?
I'm well, thank you. How are you?
I'm doing great. Well, thanks so much for coming on because this is a very important topic. So first of all, how do preventative exams help women, and when should they start considering doing these exams?
There's really no special age for a woman to begin a well woman exam. Every woman should have a well woman exam. And the way they're important is they help catch and screen for those things that just kind of creep up on us. And before we know it, we may have diabetes or elevated cholesterol, you know, that requires therapies and things. But if we can catch that early, then that's why it's so important.
Right. And so I like how you say that, because when you think of preventative exam, people might think of, you know, their annual pap smear or their breast exam, but we're talking about overall wellness exam, everything. So first of all, let's go ahead and talk about what is included in a preventative exam.
Okay. Every woman would come in to the office. They have their blood pressure taken, their height, their weight. So we're looking at the BMI.
Okay.
And then if they need the breast exam or pelvic exam, then we go ahead and do that.
Okay. So let's talk about the breast exam.
Sure.
How old typically should a woman be when she starts considering having that exam?
Okay. I would say early 20s. And what I really want to go for is self-breast awareness. You know, everybody's heard of the self-breast exam and they're intimidated. I don't know how to do that. I don't know what I'm feeling. That's fine. What I want you to be able to do is know what's normal for you. And then if you know what's normal for you, then you'll be able to figure out if something's new. And if something's new, then we need to get that checked out. So a monthly self-breast exam and then that awareness at the end of the period or the week after is the best time to do that. And then every year the healthcare provider will be doing that self-breast exam or the clinical breast exam.
Okay. So with the self-breast exam, what you'll do is if a woman has never done it before, will you show them what they need to look for and how to properly do it so they know what they're...
Absolutely, yes. And talk about those warning signs for breast conditions.
Now let's talk about mammograms.
Yeah. Most insurances say age 40 is when to start. However, if a woman has a significant family history of breast cancer, maybe younger than that, you know, maybe even 7 to 10 years before their family member was diagnosed. Medicare, usually about age 50, but that doesn't mean if we find something, we wait. You know, those are just kind of general guidelines that we go by. And Northeast Regional has the latest digital mammography here in town, so they don't have to drive.
Well, that's really nice. Yeah. Very convenient, right down the street for some. All right, now let's talk about pelvic exams. Everybody dreads it, but we need to talk about it.
Yes,
so
absolutely.
What does that consist of?
The pelvic exam has two different things. Some women are confused by that. They have a pelvic exam, they think it's a pap smear, when that's not really the case. It's a speculum exam, so we look at those tissues, make sure it's nice and healthy. Then if we need to get a pap smear, that's the little scraping that looks for cervical cancer, okay, or the beginnings of abnormal cells. If we do an STD screen, just a little Q-tip touch there. And then the other part of it is a bimanual exam where we feel for masses or pain in the abdomen.
Now, how at what age should women start thinking about this type of exam?
There are new guidelines that have come out in the recent years. 21 is the magic age for pap smears.
Really?
Regardless of sexual activity, you don't need a pap smear for birth control even. So age 21 is the magic year.
Okay. But then obviously if you are having some sort of uncomfortable feeling or anything like that, if you're younger than 21, then...
Absolutely.
Or if cervical cancer or anything runs in your family as well.
Yes, it's always tailored to the woman. There is no cookie cutter care for women.
Right. Now let's go ahead and talk about lab work. What type of lab work do women need to get done, and what does that look for?
Right. The recommendations say lab work every 3 to 5 years, but if you're on medication, you have a strong family history, or if you have a medical condition that needs monitored, then you can do that yearly. But usually with a preventative exam, we screen for diabetes and elevated cholesterol, triglycerides, maybe a CBC to check for anemia, maybe looking at the thyroid level. You know,
Right.
those are some mainstay labs.
Okay, and finally, what else is included that you might not think of when you do go get these preventative exams? Like, are there
Right.
education pamphlets or anything like that?
Absolutely.
So, talk about that.
And it's actually my favorite part. So my preventative exams are like 30 minutes.
Okay, good to know.
Because I like to kind of draw out those questions.
But that's good because a lot of people, I know that at first, especially when I was younger, I was so embarrassed to ask questions, and not just because I might not even have that condition or anything, but I was scared to ask about different birth control options or anything like that because I'm afraid that you're going to know something that I don't want you, and so I like that you draw those questions out. I really do like that. So,
Right.
so talk more about that.
Right.
Like,
Big thing is diet and exercise. Talk a lot about, well, how many calories are good? That's based on every person. Work up to exercise 5 times a week for 30 to 60 minutes. I don't expect you to do that day one,
Right.
but that's our goal. We talk about incontinence. That's a big secret. Nobody wants to talk about that. And like you said, the birth control options. We talk about immunizations. Have you had your flu shot? Have you had your pneumonia shot? Have you had the Gardasil series?
Right.
All those different things. If you're 50, have you had a colonoscopy screening? Nobody wants to talk about their
Right.
bowels, or any risk factors there. So
interesting. And then, of course, we always have pamphlets and information guides for them as well if they have any
Absolutely.
other questions. Well, what we'll do, thank you so much. What we'll do is we'll post everything on our website at heartlandconnection.com, all these information and guidelines, as well as Angie's information with Complete Family Medicine. So
Absolutely.
if they have any questions, again, thank you so much for
No
coming
problem.
on.
Thank you for having me.
And we'll be right back.